The Clear Access Spine Surgery Table by OR Safety was developed to maintain all of the utility of competitive spine tables that are generically referred to as Jackson tables, while removing all of the notable drawbacks of those types of systems. The table maintains head-to-toe C-arm access for lateral, anterior, and posterior spine procedures, and can support the simultaneous use of two C-arms. While maintaining such unrestricted C-arm access and providing target site radiolucency, the Clear Access table has a safe working load of 600 pounds and has a noticeably more stable operating surface, particularly for heavier patients. Without outboard wheels, the table allows shoulder-to-shoulder docking with the gurney, which facilitates safe patient transfer onto and off of the operating platform. Finally, and perhaps most notably, there are no towers at the head or foot end, completely removing the need for T-pins and allowing anesthesia direct access to the patient's head and airway. Notice that without outboard wheels and towers, the Clear Access table has a dramatically smaller footprint than the competitive systems. A small footprint has been shown to be a significant benefit in the increasingly crowded ORs, hallways, and storage areas of most facilities. Specifically, Jackson-style tables commonly occupy more than 26 square feet of space, while the Clear Access footprint is less than 12 square feet. Importantly, the Clear Access table is the only spine table on the market that has 3 preset configurations, each configuration organized in response to customer feedback and intended to deliver the right amount of equipment to fit specific types of clinical practices. The ASC solution is configured to support practices dedicated to outpatient spine procedures and interventional pain management. The new standard is configured for hospital-based spine practices and can support anterior, posterior, and lateral spine procedures. The neurocervical configuration supports practices that include brain surgery and posterior cervical procedures requiring cranial stabilization. In this video, we'll highlight the Ambulatory Surgery Center Solution configuration, otherwise known as the Clear Access ASC solution. This is the simplest configuration of the Clear Access table, and it includes the Clear Access table base, the supine platform or flat top with comfort pad, the standalone FlexFrame, and multi-directional armboards. To begin, we'll focus on the setup of all of the components of the Clear Access ASC solution. Depending on surgeon-patient positioning preference, this arrangement can be used for most posterior spine surgery procedures. Many of these procedures can be performed on an outpatient basis. Move the Clear Access table to the preferred location in the OR. To lock the table to the floor, press any button on the hand controller to wake it. Both hand controllers will auto-sleep if inactive for 30 seconds. Press any button to reactivate, and then lock the table by pressing the wheels button firmly once and releasing. You'll note an audible beep as the table is lowered to the ground, warning caregivers to keep personnel and equipment clear of the table. Next, install the supine platform or flat top onto the table. To do this, bring the supine platform over the table and lower carefully into the cradle. Once the supine platform is completely seated, depress both thumb releases at each end of the table to collapse the handles into the platform. Collapsing the handle at the foot end locks the supine platform into the base. To install the FlexFrame, place it in the desired location for the patient's torso during the procedure, leaving enough room at the head end of the table for the patient's head and supporting face pillow. Secure the FlexFrame to the table using all 4 orange safety straps, one at each corner of the FlexFrame. With each strap, run the strap through the foot of the FlexFrame, down and around the continuous side rail of the Clear Access table, and then back up and through the D-ring of the safety strap. Pull down firmly to ensure that the FlexFrame is securely fastened. Repeat with the remaining 3 safety straps. Note that the safety straps are necessary to ensure that the FlexFrame will remain in place, especially in instances of extreme angulation, including lateral roll, Trendelenburg, or both. Place the face pillow at the head end of the table, close to the FlexFrame and in the expected location of the patient's head. To install a Clear Access armboard, bring the armboard in at an angle that is superior to the side rail to engage the top of the side rail first with the armboard lock. Lower the armboard to engage the bottom of the side rail. If necessary, slide the armboard toward the head end or the foot end before locking the armboard onto the side rail. Lock the armboard onto the side rail by firmly hand-tightening the locking mechanism hanging from the bottom of the armboard lock. Once the armboard has been attached to the side rail, it's possible to arrange the armboard in an unlimited number of positions by supporting the armboard with one hand while moving the elbow of the armboard to a desired location. It's advisable to place the armboard lock and the elbow of the armboard toward the head end of the table rather than the foot end to prevent interference with the surgeon during the procedure. Once satisfied with the location of the armboard, lock the armboard in place by hand-tightening the large black knob at the elbow. Verify that the armboard is secure, then repeat with the second armboard on the opposite side of the table. Once the patient has been positioned on the table, use patient restraint straps to secure the patient to the table before draping and preparation for surgery. Adjust the FlexFrame and armboards as necessary for patient comfort and to minimize the risk of pressure marks on the patient. Click the FlexFrame link for more information regarding the use of the FlexFrame system, and consult the Clear Access instructions for use with any further questions.